A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. The American Sexual Health Organization, ASHA, defines sexual health as the ability to embrace and enjoy our sexuality throughout our lives. ASHA notes that being sexually healthy means knowing that sexuality is a full and natural part of life and being able to recognize and respect the sexual rights that we all share. Having access to sexual health information, education, and care, putting a stop to sexually transmitted diseases and unplanned pregnancies, and seeking care and treatment is when needed is very important. Welcome to this very special edition of your Hometown Health Connection, presented by the Community Health Center of Buffalo. And on this program, it's all about things related to sexual health. I'm John Di Sciullo. Welcome to our program. Let me introduce you our guests from the Community Health Center of Buffalo. Emily Murphy, Women's Health Nurse Practitioner. Murphy oversees the Women's Health Services practice at the Community Health Center of Niagara Falls. She's been a nurse for almost 15 years and is focused on being a Women's Health Services Practitioner, now approaching 12 years. After joining the Community Health Center of Buffalo in 2018, Emily helped establish a full-time Title X-funded family planning program at the center's Niagara Falls site with a federally qualified health center grant. She's also been instrumental in developing and implementing strategies to improve patient rates and productivity, and spearheaded a collaborative effort with an adult and pediatric primary care provider, dental providers, and the CHCB's behavioral health team to implement a patient-centered care model, very devoted. LaTarcia Daniels, Director of Family Planning. Daniels joins the Community Health Center of Buffalo as its new Director of Family Planning, previously at the Catholic Health System's Women's Health Services Practice Manager there, where she oversaw practice operations. Prior to CHS, at Catholic Health, Daniels' prior experience included having worked at Roswell Park Comprehensive Cancer Center, Blue Cross Blue Shield of West New York, and Kaleida Health, an experienced manager with a demonstrated history of working in the hospital and healthcare industry. Ladies, welcome to your Hometown Health Connection.
Thank you. Thank you for having us.
You're welcome. You're welcome. So we have a lot to cover in this 27 minutes that we have, so we want to get to as much as possible. LaTarcia, let's start with a quick overview of the family planning program that the Community Health Center of Buffalo offers. What are its goals and its mission?
Well, some of the goals of the Community Health Center's family planning program is to offer services to the underserved community for women, men, the LGBT plus community, for the underserved and the low-income population. It can be, you can have insurance or not have insurance, and we offer it on a free basis or a sliding fee scale. Our goal is to reduce the unintended pregnancies. Our also goal is to provide education to the community on, STI education, especially also offering services to reduce the infant immortality rate in the Western New York community.
A big mission, but it's a very welcoming place, isn't it? We talked a little bit about that. When you first got there, you felt a great sense of connection to the
Yes,
CHCB.
I did. It was amazing to see and to walk into a building where I saw providers and staff that looked like me. Providers and staff that are very involved in the patients and their needs, not just their needs for, GYN services, OB services, but all around primary care. We also have dental services. So it's all-encompass, all-inclusive, and it makes you feel very welcome. Our waiting rooms are welcoming, our staff are well-trained and very welcoming, and also our providers.
Let's get into some statistics. There's one here, about 50% of all pregnancies in the U.S. are unintended. And do you think that that's related to education, social strata, the use of social media? What do you think makes that number so big?
I think that's a great question. A lot of our patients come to family planning, not just for family planning, but they come for family planning, but they also come for, they may not have been to a primary care doctor's appointment, and that can be because of a barrier to have access to care. We have patients that may not have transportation. We're able to provide those services. We're able to provide services as far as counseling. We're able to provide services for, domestic violence, for, social depression screening. So it's all encompassing. We're out in the communities. We're servicing the communities that we have. have, and we're meeting patients where they're at. We're meeting their needs. We're listening to the patients. We're listening to the community, and we're active in the community.
Very important to be where the patient is.
Yes.
I've heard that before from other healthcare providers.
Yes.
Emily, let's come to you. We talked a little bit about teen pregnancy, and the rates across the nation, from what Buffalo Healthy Living magazine tells us, are decreasing, but in our hometown in Erie County and Buffalo, they're on the rise. What would you offer as an idea as to why the teen pregnancy rates are on the rise?
Yes, teen pregnancy rates do remain high in our area. Just to build on what LaTarcia was saying before, so certainly access to care is a huge factor. If a teenager can't get to the clinic, they're not going to be able to take advantage of our services. Also, if they just aren't aware of what potentially their birth control options are, where they can get free condoms. If they're not aware of the things that we have, or they're not educated to know that you require contraception or condom use, certainly that will be a huge factor in the teen pregnancy rate as well.
Can a teen come into the center without a parent, if they're underage or minor?
This is a really great question, yes. So we do offer confidential services for adolescents and teens at all of our facilities.
Because you want them to feel comfortable and welcome and be able to get information that they really need.
Yes, so we do encourage parental involvement. It's really important to make sure that you have an adult in your life that you can reach out to if you did need to speak to an adult about an adult situation. But we do want to offer a confidential visit where they can come in by themselves, and that allows them to develop trust with the provider and then really be able to access the care they need for the specific services they might need that day.
Right, and feel comfortable, not a stigma attached with the conversation.
Yeah.
You talked a little bit about condoms and contraception. Talk to me about what you offer and the education and the kind of contraceptive discussions you have.
Sure. When we're talking about contraception specifically, we do offer all FDA approved forms of birth control. That would include IUDs or intrauterine devices, contraceptive implants, birth control pills, patches, rings, the Depo shot, condoms, other barrier methods that are out there. And we also offer emergency contraception, which is a pill that can be taken after unprotected sex within the last 5 days to help reduce the risk of pregnancy.
So really, the Community Health Center of Buffalo has all of this available to the community. And you're in Niagara Falls, and there's a location in Buffalo as well. Do you see a lot of activity from where you're at in Niagara Falls with people coming in?
We do, and we're fortunate to be located right in the middle of the community that we serve. So we're talking about access. That's exactly why we are where we are. So hopefully we can reduce any barriers for patients to come in for all of our services.
Right. So somebody doesn't, say, live in Niagara Falls, and they say, well, I have to go to Buffalo, and they wouldn't do that. They'll come right to your location. And we'll find out where that is in just a little bit. LaTarcia, let's talk about specialized programs or services. You mentioned some of the other areas that the Community Health Center of Buffalo offers services for people that come in. Let's talk about some of those specialized services.
So some of our specialized services that we have is what we call patients come in, and if a patient comes in and they're not insured, we have them fill out information as far as applying for family planning. And what that means, it goes by their income, so it's income based. The patient can also come in and they can have insurance, and if they have a high deductible, we can offer it at a reduced or even free rate for family planning services. So that's provided for patients free of charge. It's also all of their our services are confidential. So it's confidential for the patient. It's also confidential if a teen comes in. So we have confidentially services, and we ensure and we guarantee our patients that. We also have services that we provide primary care. So when patients come in and say, for example, they're seeing their primary care in our building, which is in the same building, our primary care providers have our patients, hey, have you seen family planning? You want to talk, you're engaged in having sex. Oh, well, let's get you in with our family planning provider. We offer walk-ins. You don't have to have an appointment to come in. You can just walk right on in. Patients can call. We have emergency services as well. So some of the other specialized services that we have, we also do referrals for, postpartum depression screenings. We do referrals for domestic violence. It's all encompassing, and we're right here in the middle, in the heart of the community.
That's sometimes a very daunting challenge when you talk about insurance and the financial piece of it.
Right.
How do you work say with a teenager, or maybe even somebody who is a parent or a grandparent that comes in and says, LaTarcia, I need help going through this. How do you work with them to make sure it's not so complicated?
So we work with them with, we provide them the education, the tools. We have health educators as well as our providers who work one-on-one with each patient, and we see them through every step of the way. We ensure, because we want to make sure that they're educated with the services they're receiving and to feel confident to receive those services.
Yeah.
We do encourage family involvement, but we do have those patients that they may not have that family support. So we're here to provide them with the support and the guidance to ensure that they're receiving the best care as possible.
Yeah, and it's a diverse community that we live in.
It is.
Particularly in Buffalo. I
It
remember
is.
doing some programs with the Buffalo schools, and there's so
Yes.
many diverse nationalities that come
Yes.
in. Do you have language issues at all?
We do. We have free translator services for our patients. We want to make sure that patients are receiving services in the language that they speak. We have our staff that are well trained and well equipped. Those services are free of charge for patients to receive the care and the services that they need in the language that they speak. So, and that's free of charge, and we ensure our patients of that. We also serve the LGBT plus Q community.
I was just going to ask that,
yes.
because so many things now are
Yes.
being discussed, LaTarcia, with transgender and
Yes.
non-binary individuals.
Right, and we want to make sure that we're meeting patients where they are. We're addressing patients the way they want to be addressed. We have trainings for that for our staff, for our clinicians, especially for our frontline staff. When patients walk in, they see an environment and they're comfortable in the environment that they're walking in.
And you mentioned the LGBTQ plus community as well, in the same vein.
Yes, and we're also collaborating with a lot of organizations within the community. We also collaborate with communities and organizations that seek out low-income individuals and communities, and that's one of our goals, because we want to make sure that we're reaching everyone.
And when you say collaborate, would that be with area medical organizations, with churches, with
Churches, schools, you name it. We actually have National Healthcare Week coming up next week, and so we're going to be out in the community. Anyone can go on our website and actually see the list of events that we're going to be doing within the community, who we're going to be collaborating with, and that's just one of the many ways that we have our services known within that community, but to let the community know that we're here for them.
And I would think, Emily, that this discussion piece, the outreach is very important, and having that communication, particularly at the school level, the parental level. There's a lot of grandparents that are watching the show, or I would define them as people of influence in a young person's life. Having that communication is important, but it sometimes doesn't always happen, does it?
I think this is a really important topic. This is a conversation I'm having with my teenage patients, my adolescent patients, but also my patients who are adults and have kids of their own and are thinking about bringing their kids in to come see us for, GYN reproductive family planning services. So what I always tell my parents is that it really just starts with a conversation. And the more open you are, the more open your child is going to be. And if you're uncomfortable discussing, reproductive health topics, if you're uncomfortable discussing sex, they're probably going to be uncomfortable as well. So even just starting a simple conversation can really open up the door for years of open communication.
Just when you think it's the most, and I have a 23-year-old daughter currently,
Okay.
just when you think it's the most awkward topic in America to talk about, if you don't have, I have found, that open line of communication, you really are behind the curve. And it's not just with sexual health in the sense of becoming pregnant or not. There's sexually transmitted diseases that, we hear about certain things. How prevalent, Emily, is that? And what are the diseases that people should be concerned about? And how do you talk to the parent and the teen about how to prevent that?
I think when you're just having a conversation between parent and child, I always suggest, saying like, I was your age once, I completely understand, where you're coming from. This, I can take you to the clinic. We can, teach you how to use a condom, what, various types of birth control are out there. Sometimes what I'll offer is, a visit where, I do see an adolescent or a teen, and, I say, of course, bring, mom with you or dad with you if you want. We'll leave them out in the waiting room. We do offer confidential visits. So that gives me time alone to, speak to the patient and, kind of understand what's going on, give them a chance to advocate for themselves and also be able to ask questions without judgment or fear of judgment. different. And then we can always bring the adult back and just wrap up together and say, here's what we talked about, and here's how, here's our plan today, and then here's how we're going to take care of you going forward. At the end of the day, everybody wants the same thing. As parents, we want our children to be healthy. And children want to be healthy too, and they want to live, they want to be safe and they want to live a good life, and we want that for them. So we all want the same thing.
In addition to the sexually transmitted diseases, and first of all, let's talk about what some of them are out there so people can be more familiar with that, because they may hear terms that they may not have heard about in a while. What are some of the things we should be looking out for?
Sure. Common STIs that we do see in the clinic would be gonorrhea, chlamydia, trichomonas. Those are pretty common ones. We also, talk a lot about HPV, HIV, syphilis, all those things. So, as far as testing goes, it's important to have conversations with my patients about when to get tested. And certainly that might look different for everybody, depending on your situation. I typically encourage patients to come in at the beginning of a relationship. Also kind of if like a relationship or situation is wrapping up, it's important to get tested at that time. And then it's important not to wait until you have symptoms, because a lot of people will not have symptoms of, certain STIs across the board. So it is important to make sure that you're coming in routinely. And then for people under the age of 25, the CDC actually recommends annual STI testing regardless of relationship status. So it's important to come in once a year, at least minimally, and get screening done.
We have about 10 minutes left. We have a lot to cover still. I want to follow up on that too, because if somebody does have something that they've picked up, a sexually transmitted disease, they should not feel a stigma in getting it handled. They should just come in and get it taken care of.
Yeah, and we offer same-day treatment visits if needed.
LaTarcia, Emily mentioned HIV, and we were sharing a story years ago on another television program that I worked with when HIV and AIDS was first out there, now HIV. There was an incredible stigma attached to it. So many advances have happened medically, but HIV is still something to be very concerned about. And the statistics are pretty high, particularly in the Black population. Talk to me about that and what you do to educate people about HIV prevention and what to do if somebody has HIV.
Great. So some of the things that we do in our health centers is that we educate and train our staff. We actually have, this is great, a new program called Sister to Sister that we're going to be implementing this quarter for our patients, and we're going to be educating our staff. And what that program is, it's a toolkit that we're going to provide our staff to educate the patients while they're in the exam room on ways to properly use a condom, on ways to properly advocate for themselves so they are not coerced into having unintended sex. So it's a whole toolkit that we're going to be providing, a training for the staff to train the patient while they're in their exam room at the time of their visit to provide that education for them. And you're right, HIV, the stigma, it's so different now. It's kind of shined upon. But I think for us, the one thing is that we ensure that we make our patients comfortable to have that open conversation and to not feel ashamed. We have staff that are open and comfortable of having that conversation and providing them, those resources, and to also provide the patients with the resources. So it's all about educating and also being able to self-advocate. We're educating our staff, we're educating our clinicians, and in return, we're educating the patient and what's best for the patient, and to ensure that they feel comfortable to know, okay, I'm doing this the correct way. Okay, these signs aren't good. I'm in a relationship and I don't feel comfortable. These are the signs that I'm recognizing. I need to step away. So those are some of the things that we're doing. And I'm just amazed, and I look forward to, as I'm joining CHCB, I'm looking forward to the growth of family planning.
That's terrific. And I think we should just follow up a little bit with HIV. This is something that everybody should be concerned about, not just the LGBTQ plus community.
Right.
This is something that really everybody should have some level of concern about, based on what you just said.
Yes.
This is a long, involved question, Emily, so I'm going to make sure I get it right. The Sexual Health Medicine Society of North America noted that young people who can discuss, as we mentioned, the sexual issues that they have with their parents. But let's talk a little bit about not only the conversations with parents, but the conversations with peers and friends and social media. Because you had talked about how the parents have one level of influence. But if people are embarrassed to have these conversations with their parents, they sometimes jump to a different person that might be in their life? And feel free to both comment on this, because I think it's a very important topic. But how would you address that if the parent isn't speaking to the child about it, or the child's not speaking to the parent or a person of influence, and they go to a friend? How important is it that those peers, particularly if it's the wrong information, that the child not listen if it's bad information?
I mean, I think sometimes until you come to a visit at the clinic, you might not know what's right and what's wrong. I encourage all my patients, if something's going on at home, you maybe can't talk to mom or dad, I encourage them to find another adult, a trusted adult. It could be an older sibling, an aunt, a friend's parent maybe that you trust, a school teacher or counselor. Everyone should have an adult you can talk to about adult things. And then I encourage everybody just to come in for a visit, and we're happy to answer any question that you have regarding reproductive health.
Do you find some young people go on social media and they see something and take that as
all the time.
the real truth?
Yes.
You got to be careful about that. So many of us do on so many topics.
Yeah.
Young people so influenced by so
Yes.
many of those things. And let's talk a little bit about the nation that we're in. There's so many policy changes when it comes to the metrics of family planning. How do you both keep up with that, in the sense of what's available out there, what people are responding to, what society is saying that should be happening? How does that interact with what you're doing?
Well, that's a great question. You know, our metrics and our reporting structure, we report to the health department, and we report on certain metrics. We have to report on the number of patients we're seeing, how many visits. One of the things we report on is our testing of chlamydia between the ages of, I believe it's 15 to 24-year-olds. So it's all on our reporting metrics, and to ensure that we're reporting on and seeing low-income individuals. But with the policy changes, administrations change within the country. We know that. We have services that they try to take away, but we also have our Title 10 program has been around for years. And I think it's amazing because it gives access to those individuals that previously may not have that access. You can have someone come in, in the community that they don't know, well, I don't have insurance, so I can't get services, or they're going to the emergency room and all of a sudden they have an emergency bill. Our goal is to let these individuals know that we're here in the community and we can service you free of charge. You should have this access for your health. It's for your health. So it's, having that education, being able to have that information. And as we all say, knowledge is power.
Yeah, that's true. That's very important.
So yeah.
Let's talk about the Refer a Friend, Emily. This is something focused on the Niagara Falls location. Explain what that's all about, because I understand there's some gift cards available with your first appointment, and how can patients get involved with the advocacy programs there?
Yeah, I would say if you know someone in your life that can benefit from our services, please send them our way. Right now, all new patients are getting a $10 gift card, just as an extra incentive, to welcome you into our doors.
Where is the Niagara Falls location?
Our Niagara Falls location is at 2715 Highland Avenue in Niagara Falls.
2715 Highland Avenue.
Yep.
Okay. How long have you been there, Emily?
About 5.5 years now.
Yeah. What does it mean to you to see people come through, and the gratification of knowing that you're helping people particularly in such a formative time when they're teens?
I think it's everything. Just being able to see people come through my door and know that the information that we give them will help them stay safe, stay healthy, help them be discerning when it comes to, maybe relationships with partners. We want everybody to just be safe, happy, and loved, and then just to see people come through and, be able to go to college and then plan their pregnancies whenever they want to, whenever they choose. To me, knowing that we help patients write their own stories is why I come to work every day.
Yeah, that's terrific. You're really out there for the people. And LaTarcia, same with you, because you've had experience not only with CHCB, but in other institutions in Western New York. What does it mean to you to help people?
I think for me to help people is just, I can kind of piggyback what Emily said, is just being able to see those individuals and know that they're educated and they're being able to self-advocate for themselves. You know, I'm a mom, I'm a Gigi, not a grandma. So being able to know that they have those skills and that education and that knowledge to be safe out there. So it's just being able to know that and see that, and being able to, that they're able to, you know, plan their family when they want to plan their family, and to have a healthy family, and to know what healthy looks like. What does healthy look like for me? You know, we have different services where we offer vouchers for, you know, fruits and vegetables, to have them understand what it means to be healthy and to see it and to pass it on for generations. That's amazing.
So our discussion today, not only sexual health, but that dovetail into
Yes.
all health.
All health,
That's,
yes.
CHCB is
Yes.
so important in
Yes.
the community. Well, we want to thank Emily Murphy, Women's Health Practitioner, and LaTarcia Daniels, Director of Family Planning for the Community Health Center of Buffalo, for joining us for this important conversation. Continue your good work, ladies.
Thank you.
Thank you so
Thank
much.
you so much. Thank you.
Thank you, and stay with us because we've got some very important phone numbers. And well, you know what? Well, let's start right now with the Community Health Center of Buffalo and their comprehensive services, including contraception and emergency contraception, preventing unintended pregnancies, reproductive health concerns for transgender and non-binary individuals, comprehensive services for teens, women, men, and the LGBTQ+ community. You can find that information online at chcb.net, and you can call 716-986-9199 for an appointment, or as we mentioned, you can just walk in. And they're at 34 Benwood Avenue in Buffalo. And where is it again in Niagara Falls, Emily?
2715 Highland Avenue.
2715 Highland Avenue in Niagara Falls. Remember, CHCB serves all patients regardless of insurance. I'm John Di Sciullo. Thank you for watching. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.